Paul Seegert's a managing partner at PCS Advisers. That's a healthcare benefits consulting firm. He's joining us this morning. Hey, Paul, good morning. How are you?
I'm doing great. Thanks for having me.
Yeah, Paul, it's a tricky situation, I think, for many healthcare providers, and a lot of this depends on, how big you are, your location. Of course, all those things play a role here, but it is tricky because not everybody's a Mayo Clinic. Not everybody's going to line up and say, okay, fine, I'll get the vaccine.
Well, and if you're in that profession, what better place to work than Mayo Clinic? So they have a deep hiring pool, but if you go into rural America
Right.
or smaller systems, or even subsectors of the industry that have very high vaccine hesitancy, like elder care facilities, ironically, where it can be as high as 50% of their staff. I've talked to CEOs, clients that are in these industries or parts of the industry, and they have real fear about putting a mandate in place because they had a shortage before the pandemic of good workers. And now if they do that and drive away, they can't afford to lose 10%, never mind 20 or 30.
Right. Yeah. Well, Paul, when you talk to people, what are you hearing?
Well, they are, it's interesting because some of these employees do have a legitimate issue that they raise. Some of them say, hey, look, I've had the infection, I've recovered, I've had antibody testing and T-cell testing, and I have immunity. Why should I have to get the vaccine? Which actually there's, science that supports it. Emory University put out a study here in the last few weeks that supports that. So it's not that it shouldn't be possible to have a conversation about it. But you do certainly understand the employer's position that we need to protect our staff and our clients. And the vaccine is known to be effective against severe cases of illness that will hospitalize you. And our system has spent $2.3 billion in the last 2 months, almost exclusively on unvaccinated people that have been hospitalized from COVID. So clearly there's work to be done still.
Yeah. Well, here's the other effect, too, if you're short-staffed, right? So some of these hospitals, and this isn't just, relegated to hospitals, but you look at some of these healthcare providers, and if you're short-staffed, well, guess what that does to the current staff? Like all of a sudden they're working more hours,
Right.
They're working later nights. They get burned out, too.
No, it's already an industry that suffers from burnout, and they're worn thin at this point. So then you have CEOs of some of these facilities calculating that as well, or factoring that into their calculations. Can I afford to put even more strain and stress on my system and make this mandate? So what we're seeing is oftentimes it's called a mandate, but it's really strong encouragement with some other options. You can have a religious exemption. You may have a medical exemption. We're not yet seeing exemptions that account for natural immunity, although there are some lawsuits that we're watching between employees and employers that could lead to that. And we'll just have to keep an eye on that.
Yeah, we're talking with Paul Seegert here, PCSadvisers.com. Okay, Paul, when you talk to people, will the FDA's full approval of that Pfizer vaccine, is that going to change the position of these healthcare providers, or at least some of them, where they now will just say, look, it's our responsibility to mandate this, unless you have like some sort of religious exemption or some other underlying condition that would cause you not to get it?
Well, yes, it will affect some. I think we're at 27% of healthcare workers nationwide. That varies geographically in urban versus rural and other factors, but we'll call it 27%. And 1 in 3 say that full approval would influence their decision to get vaccinated or not. So we should pick up more that say, okay, I'm ready to get vaccinated. But I think that still leaves, maybe we're still left with 20%, 15 to 20% that say, hey, under no circumstances am I going to do it. I'll just leave and go work somewhere else.
Yeah. What about from a healthcare provider? Because I thought, with the vaccine becoming fully approved, we knew it was coming. We knew it was going to happen. We didn't know exactly what day, but this happening was not a surprise. It was largely symbolic for the most part for a lot of people. Yep. I wonder from a healthcare provider if that was just like now there's no other excuses. And I wonder if they now then take that next step and say, we're going to have to mandate it now because it's the right thing to do. Look, we're a hospital. We have to be able to take care of people who are sick here, and we need to protect you first and foremost so that you don't get anyone else ill, including your family.
Yeah, we're going to see more mandates. There's very little reason not to. It was well established. The EEOC, employment lawyers across the country were all pretty much in consensus that even under the emergency approval, you could mandate it as an employer because people still have the freedom to. They have some the religious exclusions and so on, but they also have the ability to say, I can go work somewhere else. So they can mandate it. I expect we'll see many more of those mandates come out, and it's going to get more and more common. So there'll be less and less places to go to avoid it.
Yeah, Paul, last thing for you. Is there any way, and I just want to have this dialogue here. So is there any way that if they do not mandate it, I look at like what the NFL is doing. Basically, they're not mandating it because they can't because of the players union, but they're kind of saying, look, it's going to be really difficult for you to be able to play in the NFL, right? Like, I wonder, and I'm sure a lot of these are doing that, but is there a way where you can say, okay, we're not going to mandate it, but here's an incentive for you to do it. We're going to continue to educate you. You're going to be tested every single day. Like you're going to have to mask when others won't. Of course, most of them already do, but you know what I'm saying? Like you create this environment that says, sure, you don't have to, but it's going to be difficult for you to,
it's going to be very coercive and really a pain in your neck if you don't. And that's really the lawsuit, one of the ones that we're watching closely between the law professor and George Mason University. He had COVID, he recovered. He's been tested. His immunity has stayed strong for over a year now, and he has the tests to show it. And his university is saying you have to get the vaccine or you have to get tested 3 times a week and wear a mask and do all these other things that are going to make his life very inconvenient. His position is, hey, look, I had it. I can show that I have natural immunity that is as strong, if not stronger, than some of the vaccines that you would accept for your mandate. They'll allow him to get the vaccine from China as an example that we wouldn't do in this country or use because it's only 50% effective. So I think we will see that more and more. We'll watch that lawsuit and some others. Regardless of the outcomes of those, I think we'll see lots of policies that aren't really mandates, but they're more like what you've described, where it just becomes very inconvenient to not get vaccinated.
Yeah, great word for it. Paul Seegert, I appreciate the conversation, Paul. I'm glad we were able to connect.
Yep, thank you.
Yeah, managing partner at PCS Advisers, a healthcare benefits consulting firm. That's PCSadvisors.com. So